When it comes to eating disorder treatment, there are actually multiple different levels of care for treating eating disorders. And the reason that is because when someone is in the midst of working towards recovery or in the midst of severe disordered behaviors, they may need varying levels of support. So I'll touch briefly on what those levels of care are in a minute. But today what I really want to focus on is a case study of an individual who was in a higher level of care for an eating disorder, came to outpatient, but still needed to work on recovery. And the reason I want to touch on that is because something that I often see is that someone will go to a higher level of care. They may go to a residential treatment or something like that. And then once they're finished with that particular program, they kind of think that they're done. They kind of forget that there's still a lot that we have to do once you're back into kind of normal life or back in an outpatient setting or whatever it might be to continue to full recovery. And I think the reason that happens is because a lot of times the work that you do in a higher level of care is so intense that you get a little bit tired, which I totally understand. But this case study will explain why we have to keep working towards full recovery, even once you've already been maybe in that higher level of care for your eating disorder. So briefly, I'll talk about the levels of care for an eating disorder. And so what they are from kind of lowest to highest are outpatient, intensive outpatient, partial hospitalization program, and then residential and inpatient level of care, right? So outpatient is the lowest. It's just, of course, you would go see your dietitian once a week, your therapist once a week, or something like that. Intensive outpatient is actually usually when there's a little bit more. So maybe you have an intensive outpatient program that goes from 2 to 6 p.m. on Tuesday, Wednesday, Thursday. And really what it is again, just more support. You often share like dinner together or something along those lines so that you just have more than just the one appointment a week or whatever it might be at an outpatient level of care. And then partial hospitalization is kind of the next step up. And that's when you're actually in what we call in programming all day. So a lot of times the hours might be, 8 a.m. to 3 p.m. and you go and you're in programming from 8 a.m. to 3 p.m. Monday through Friday. And they do that so that you can be eating more meals with those people and getting the support for working towards recovery. And then of course there's residential and there's inpatient. Now both of those you're going to go and you're going to live there and you're going to stay there 24/7. But the difference between the two is that inpatient, usually you need some sort of medical stability. So you have to be quite literally in a hospital or inpatient setting because there's something medically going on that you need to be supervised for that. Whereas residential, you don't need the medical stability. So you're still working on eating and having all those supervised meals and therapy and all of that stuff, but you just don't need the medical stability. So those are the levels of care. Now, the case study that I want to talk about today is someone who actually came from a residential treatment facility to outpatient and saw me. And so she had done some awesome work in residential and really worked on improving a lot of her eating disorder behaviors, getting herself to take in more food. But when she got to outpatient, she experienced exactly what I explained to you earlier, that she was feeling like she was kind of done and that she could back off on her meal plan and she could get back to exercise and all of these things. So I want to share with you today her metabolic test to prove that that's actually not the case. So let me first just mention that this person had actually come to me before going to residential treatment. So she had come to me for one visit. We had figured out that things were pretty dire and we kind of immediately worked on getting her to residential because that was the level of care that she needed at the time. So I did have some baseline information on this person before going to residential treatment. Let me first just say that this particular individual was 35 years old. She was 5'8" and 100 pounds. So that's why we initially were like, you need to go to treatment. This was way too low. And her intake was incredibly restrictive. She wasn't eating much all day and she was doing a lot of exercise. And I was just really worried about her medical stability there. Now let's take a look at her first metabolic test. Again, this was before going to residential treatment. So as you can see here, her metabolic rate is drastically low. And that is because she was restricting really, really heavily. She was over-exercising. Her weight was really low and her metabolism responded in this way by being really, really low. Remember, your metabolism is going to drop when you're not taking in enough food because it doesn't want to burn more than it's being given. What we're also seeing here is that her protein substrate was drastically too high, meaning that her body was breaking down significantly too much of her lean mass. And that, again, was one of the biggest reasons why I immediately recommended this person go to higher level of care for her eating disorder. Now, this person was in treatment for quite some time. She was there for about 4 months and did some excellent work. So what I want to preface by saying is that treatment was great for her. She needed this. This is what she absolutely required for her recovery, and I was so glad that she went. However, like I mentioned, when she came back from treatment, she was excited and felt that I was going to tell her that everything was great and she was just done. But let's take a look at her metabolic test result after coming back from residential treatment. So as you can see here, her metabolism looks exponentially better. I mean, that is way better. However, it's still not where we would predict it to be. So whereas it's way better from when we started, it's still not quite fully corrected, telling me that the body is still compensating. You can see the same thing with her protein substrate. It is so much better than it used to be, but it's not quite where it needs to be for full recovery. Her body was still compensating with her metabolic rate being a little bit too low and her body breaking down just a little bit too much of that lean mass. Now, again, this has nothing to do with residential treatment. She was in an excellent program. They did excellent work, and you can already see that things are starting to improve. However, what this does solidify is that being in this outpatient setting, she still required more care. We actually had to increase her meal plan being in an outpatient setting to continue to full recovery. The reason I wanted to point this out is because like I mentioned before, I do think that people get from a residential level of care, just higher level of care, to outpatient and think that they can start backing off on their meal plan, when really for this person, we actually had to increase it. As you saw with that metabolic rate, it was still just a little bit too low and her protein substrate was just a little bit too high, implying that we actually had to increase her meal plan. Part of that is because now being an outpatient, she's up, she's moving around, she's doing a lot more than she was doing in residential. And so we don't want her to back off. We want her to keep working. And this is so important to get to full recovery, which is possible. Now, I know this is a little bit of a niche scenario, but again, I wanted to point this out because I do think it's really important for those people that needed to hear it, that you can work towards full recovery. And even if you're tired from treatment that you may have been in or treatment that you're currently in, we want to get you to where you're fully healed from the inside out. Thanks so much, guys. If you have any questions, please leave them in the comments. Don't forget to like and subscribe.